The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, ladies and gentlemen. Welcome to this Give Me 15 Minutes education program for medical professionals. My name is Jennifer Steerfoss, and I am the CEO of the Steerfoss Consulting Group. This presentation is covering what you need to know about ordering and referring claim edits. This is a live session being recorded on April 9th, 2013, and will be available for free through iTunes as a podcast or as a video archive with handouts on jensteerfoss.com. One quick legal note. None of the information contained in this presentation should be construed as legal advice. I encourage you to contact counsel if you have any questions regarding state or federal law that apply to the concepts covered in this session. At the end of this presentation, I will cover questions submitted during the live session. For live participants, please submit your questions using the question box on your screen. With that, let's get started. Today we have a bit to cover. Hopefully we'll be able to do that in these 15 minutes. But what's going to be covered is we're going to start off with what is this change related to ordering and referring physicians and other medical professionals. What is an ordering and referring physician? We'll talk about the claims edits that are being implemented for Medicare claims and coverage. We'll get into this mysterious system called PECOS. And then at the end of it, I'll let you know how you can find out whether or not the ordering and referring physicians that you work with are loaded into PECOS so that your claims aren't denied. So let's get down to business. If you're not familiar with the Centers for Medicare and Medicaid Services and their wonderful final rules, it's definitely some light reading for you and an opportunity to fall asleep. But way back when, and this actually started back in 2002, although there were some changes even before that in 1992, there was a series of rules that came out related to enrollment. And the rule that we're really focused on, the first one was in 2008, where there was a requirement. Originally, there was a requirement in 1992 that in the Social Security Act, ordering and referring professionals have to meet the definitions of what a covered provider is. And so, again, they could be an MD, they could be a DO, they could be other extenders, if you will. And the way that the government decided to identify whether or not you were a medical professional that was even part of this coverage was using a unique identifier, the National Provider Identifier, the NPI. And so once the NPI became the national standard, that was the first step. Then in the Affordable Care Act, Section 6405, if you're a geek, you can look it up. But one of the sections in there highlighted the fact that not only now do you have to have an NPI, but you had to be in Medicare's enrollment system. And so, once again, the ACA has some strange ramifications for all of us. There was a rule that came out in October 2009, and again, that stipulated that the medical professionals had to be in this enrollment system, but nobody was really sure back in 2009 how to implement that. So there's a couple things, and I'll go over what has been done and, again, what this means. But the implementation starts May 1st, where claims will be denied for medical professionals that do orders or referrals that are not loaded into the PECOS system, and so we'll get into that. So what are the changes? So let's, again, just break it down for you. The Medicare claims that are submitted on or after May 1st, 2013 will be denied if the National Provider Identifier and the name that is located in the medical claim does not match a medical professional that's loaded into the Medicare system. So if on a claim the NPI and the name doesn't match, which means maybe you do a nickname, somebody has, like for me, it's Jen instead of Jennifer, that claim will be denied. This is for Part B orders for DME, orthotics, and supplies. Again, Part B claims. For Part A claims is going to be for home health that require an attending physician. Also, if the claim is for a provider type that is not covered, so for instance, a chiropractor, these claims will be denied as well. So again, keep that in mind as well. So who can actually make an order and referral? So they can be done by an MD, a DO, a physician, so a dentist that has a PhD in dental medicine, dental surgery, podiatric medicine, and optometry. Those are the physicians. Now, the becoming physicians, interns, residents, and fellows are also covered, though I'm going to explain why they're a little different category. Clinical psychologists, physician assistants, nurse practitioners, clinical nurse specialists, certified nurse midwives, and clinical social workers. These are the medical professionals that can do an order or referral for a covered Medicare service. So some clarifications. Let's go back. The first one for academic medical centers, guess what? The attending or teaching physician is who really should be listed on the claim, unless you are in a state where an intern or resident can get, again, under state licensure, they actually can be licensed. If so, then you can apply for the National Provider Identifier for that intern or resident and then enroll them in the PECOS system. In that case, if there was an order or referral done for an intern or resident, guess what? You can actually use them for billing, but otherwise, the majority of academic medical centers, you're going to be using the attending or teaching physician number. Chiropractors, under no circumstances, are able to order or refer for covered services. That's, again, under the Social Security Act. They are not eligible for ordering or referrals. For home health agencies, the only ordering types of providers are MDs, DOs, or podiatrists. That's it. So none of your extenders actually can order for home health agency services. Optometrists can only order and refer for Part B items. So again, any inpatient items are not going to be something that they are qualified for ordering and referrals. And one of the interesting things, again, there was some questions about this. Medicare, when they were talking about specialties, they're not talking about the actual specialties. So for instance, a cardiologist or an orthopod. Instead, they were meaning more of the type of provider. So if there's a specialist, let's say an orthopod who's ordering, orthotics, it doesn't really matter that they had to be in orthopedics. They haven't gotten to that aspect. I do think in the future that these rules may, but this time the actual specialty and credentialing of that provider for their specialty or board certification does not come into play for claims denials. Instead, it really comes down to, again, pointing out here, for home health agencies, it has to be a physician, and for chiropractors, they are not able to do any orders or referrals. So what about opt-out providers? Here in Maryland, we have a number of providers that actually have completely opted out of the Medicare program. I'm going to cover how you can find out about them. But if you're working with providers that are doing orders and referrals that are non-participating, meaning that they accept assignment but they are not participating in the Medicare program, they will need to be in the PECOS system. They need to fill out the online version of the 855-0, which is for ordering. Obviously, they can also fill out the paper form if they want to, but I'm not a big advisor of that. Now, if they did opt out, physicians to opt out of Medicare, they need to have an affidavit on file with their local MAC. What you can do is you can go online and you can find out whether or not they have it on file. I've highlighted here for you here in Maryland. On those of you who are watching live or on the video, I've got a screenshot for you of what this looks like for the local MAC here in Maryland, and they do identify whether or not they have an affidavit on file, they have the NPI, and then they have the effective date. So very helpful information that you can get from your local MAC. But those aren't the only providers that are out there. So a couple things. There was an opportunity for you to find out if your providers that you are already doing orders and referrals for the last several years, if they were having problems, meaning if you were going to have claims that actually would have been denied. What you can do is go in and look at your old claims. There were two different remittance codes out there, so N264 and N265. They would identify if there was missing, incomplete, or invalid provider name or identifier. So if the NPI was a problem or if their name was a problem. So these would be on claims since 2009. It's something for you to look at. Most of your systems would enable you to run a report very quickly. For the new codes, just again so that you have those for the dates after services, again, that are submitted on or after May 1st. You have three new codes, 254D, 255D, and 289D. So there are three different categories of problems here when the claim is denied. One is that the provider is not allowed to refer. So again, this would be in an instance where, for instance, an ordering was a chiropractor. If there was a mismatch, so again, let's say that the name doesn't work out, or that you didn't include an NPI. Those are the three that you have on claims to know that they were denied for problems related to this. So a couple other things to keep in mind. Where can you find this information? and this is probably something that you need to be familiar with. So if you haven't played around with PECOS or are unfamiliar with it completely, this is the website. I've got a screenshot for those of you who are on live or on the video. The screenshot just points out what the PECOS system, which is the Medicare Provider Enrollment Chain and Ownership System. It is the standardized electronic enrollment system that Medicare has gone forward with. It is not the CAQH Universal Provider Data Source. It is a completely separate system, and for those of you who deal with the CAQH system, you probably have noticed that it's a really different system. But what you can do is you can actually go on the CMS website, and I do have the URL for you at the end of these slides. You can go on to cms.gov, and under Medicare, it's the Medicare Provider Supplier Enrollment webpage, and then click on Ordering and Referring Information. At the bottom of the page, they have a section that has the ordering and referring file, both in a PDF and a CSV format. They do highlight for you that there's a whole bunch of things that they highlight, and it's really interesting. The first thing is that you need to save the file. It's so big. Do a left click and save the file, because otherwise you're going to crash your system. They highlight the records are in alphabetical order, so you can do a search on either the PDF or the CSV. Name suffixes are not displayed. There are no duplicates, and this is an interesting thing because there's a lot of folks that have the same names, but it's based upon the name and the NPI. And deceased physicians are no longer in the system, so you may see that not everybody is in there. A couple other things for you to know about as well. Please know that the CSV file, I went ahead in there and went and looked at mine, and so there's actually 3 Stirfosses, which is very exciting. None of them are me. But again, it does show you how the name is in the system. So again, if you're trying to get a name match exactly, you're able to do that. And here's an example here. So for instance, in item 17 of the paper claim, the CMS 1500, the name is listed as Smith Elizabeth and not Smith Liz, for example. That would be a problem. If you had Smith Liz, for example, you actually would have a denied claim because it wouldn't match to the system. So make sure that you do have that up there. And remember, 17 is the last name and then first name and middle initial, and it needs to be in that order. And on 17B is the NPI number. So what do you need to think about here in our last few minutes? The first thing is work with your ordering and referring physicians so that you actually are able to know what their NPI is. And then once you do that, you can go into the system and validate the NPI that you have on file, so you have the correct number, and then also how their name appears. Remember, don't use nicknames. Don't use credentials like Dr. MD. Also, don't use organizations. This is a really big thing. You have to have the actual provider who is doing the order or referral. You can't name their medical group. You can't name anything else. It needs to be the actual provider. For those of you that are submitting claims electronically, which would be the majority of you, the loop that has the qualifier for the order or referrer has an indicator either of 1 or 2. 1 is for person. Make sure you're using that one and not 2 for organization, because actually the claims will deny automatically. So again, going back to where your resources are, there are 2 items on the CMS website. The MLN Matters article, SC 1305, is your go-to article. It's actually pretty easy to read and gets into the nuts and bolts of this issue. Again, the CMS files for PECOS enrollees is located on the cms.gov website under Medicare, and then into the Medicare enrollment aspects, then going to ordering and referring. So hopefully in these only 15 minutes, I've highlighted the big items that you need to know about for ordering and referring, which comes along on May 1st. Just quickly, for those of you that are on the live session, if you have any questions, please go ahead and submit those now using the question box. And if not, as you log off, please take a moment to complete the survey and give me your feedback so that I can continue to provide quality content through these Give Me 15-minute programs. For those of you that are listening via the podcast, please remember to rate this recording in iTunes. And to receive notices about upcoming Give Me 15-minute programs, please sign up on jenstirfos.com. Seeing that I have no questions and we are directly at 12:15, thank you for joining me for today's 15-minute education program. This concludes the presentation. You can log off.